Hi everyone, welcome. My name is Frances, and today I'm going to show you a release for the psoas. We're going to use a ball. You want the ball to be a pretty firm consistency, but you can adjust it. If this is a very intense release for you, you can get a little bit of a softer ball, and then you can progress from there. The first thing we'll do is just give a little bit about where the psoas is. The psoas muscle is one of the hip flexors. It crosses the front of the hip, it goes diagonally through the body and connects onto the low spine, the lumbar vertebra. It's a relatively large muscle. It's about the size of your forearm, and oftentimes if you have tightness in the psoas, you can present with back pain. So it's a great muscle to get to know. It's a great muscle to figure out how to release it. And so we'll use the ball today to release the psoas muscle. We'll start lying on our belly. We'll also release the abdominals sort of while we're at it. Now this could be a little bit intense, so feel free to take it easy. Feel free to use a softer ball. We'll start with the ball underneath your belly and pretty low down. You can come right to the pubic bone. And you're going to just start to slowly roll up the center. You can begin to lower your body down. And release into the abdomen. Now this could be a little intense. You probably want to do it on an empty stomach. We work so hard to strengthen the abs, we don't really focus on when do we release them. So it's not a bad idea to release the abdominals. And we'll do the psoas in a moment. So you can rest here for a few minutes. It might take some time to allow the belly to soften around the ball. And then when you're ready, you can roll to one side. You can use your hands, you can use your legs. As you roll to one side, you're going to attempt to bring the ball into the side waist, releasing the abdominal oblique muscles a little bit. You can move back and forth, releasing the oblique abdominals a bit. You can come back to center and you can do the other side. We'll move on to the psoas release. The psoas is oftentimes called the iliopsoas. So iliacus is a muscle that coats the inside of your pelvic half. Now there's two. And on the inside there, it sort of coats the inside of that pelvis. So we can release iliacus by bringing the ball just to the inside of the pelvic bowl. Your knee will be out to the side, and you'll attempt to get that ball sort of into the edge of the hip bone. And you can again release. From there, you can come a little bit toward the spine, a little bit toward the middle of the belly, and a little bit up. At this point, you're on the front side of where the psoas is located. It's located, basically makes up the front part of your back, so behind your abdominal contents. You can release into the ball there. Allow for softening. Breathe. You can take it a step further if you like. It's a little more intense. What you will do is then lengthen the leg of the side that you're releasing and bend the other knee. And you can start to straighten that leg, squeezing the leg straight and then bending it. The ball is located laterally or off to the side of your belly button. Now if you want to increase the connection to your psoas, you can then pull the abdominals in a bit. So you're drawing your navel in toward your spine, and then you can again continue to pump that leg as you reach back. Now when you draw the abdominals in, you feel a stronger connection to the psoas muscle. Now you're attempting to release it, so we're pressing into it. Allow the belly to soften for a moment. Draw the navel into the spine, and then again pump that leg. If it begins to feel uncomfortable, of course, you can release. You don't have to push through discomfort. And then you can release. So there you have a release for the abdominals, abdominal obliques, and the psoas muscle. Thanks so much, and have a great day. Namaste.